I would strongly advocate for a progressive ban on nicotine products. Nicotine products still cost this country, from a healthcare dollars perspective, an enormous amount of money, both directly from the injury that nicotine products cause to our bodies, but also from the mental health problems. We don't have to do it all at once, but for example, in the UK, they've started banning the sale of nicotine products to anybody 16 years old and for the rest of that person's life. So your age follows you. Your age follows you. So even when you're 17 or 18 and you started that ban at 16, you cannot buy nicotine products. And it's a slow, steady phasing out of nicotine products. And there are other ways we can do this. There are plenty of models that work amazingly well. But let's get rid of nicotine products, including electronic nicotine products. India did that. India banned e-cigarettes. There's no reason why we can't. Now, let's tax smokers. Let's tax people that smoke on the healthcare side. So if you are a present tobacco user, and there's ways to test for that, your health premium should be higher. Because what healthcare insurance is, it's a pool. Everybody pays into it. And what you want is more healthier people contributing to that pool and less ill people taking out. So if we qualify smokers like everybody else, they're going to be taking out statistically far more of those healthcare dollars. So let's force them to put more in. And the more disincentive we create, the better. And then over time, once we transform the American psyche when it comes to sugar, 10, 20 years from now, we can apply the same to people with some of those diseases. But we can start by taxing smokers on their health payments. We have to pay for this somehow. And instead of taxing me for living a good life, let's place taxes as disincentives and population changes. Now, I know there's going to be a lot of people disagreeing with me, but somebody's got to be taxed. And I don't want my taxes to go up to pay for other things. At the same time, if I'm doing something I shouldn't be doing, tax me, and then I can choose whether or not I prefer to pay the tax, or change the behavior. But when you transform these eating behaviors, when you tell people that they shouldn't be smoking, when you start to ban smoking and the sale of nicotine products, this has to be in parallel with a creation of a national focus on mental health and rehabilitation. We need to create mental health education as a system and as a primary public policy. Because the reason we are susceptible to sugar and sugar-laden products, the reason we use nicotine products, the reason we use opioids and marijuana and all these other drugs is for dysfunctional emotion management reasons. As a recreational resort, they should be available. But if we don't have a counterbalance to other forms of mental health, a diversity of mental health, these relationships with these substances very easily become dominant and excessive and dangerous to our health and to the health of our society. So I'm not saying ban all of these substances completely. The tobacco we can get rid of. There's one other one that we'll talk about. But if we focus on healthy mental health, treating people but teaching people about what healthy effort-based mental health is all about, and create that at a national level so that it's affordable, you can still privatize it, but it should be monitored. Because all too often right now, rehab facilities are unregulated and charge an arm and a leg, or use their desperate clients. They prey upon them as a vehicle to enrich themselves. And we can do so much better on mental health education starting at pre-kindergarten. Mental health should be a formal part of the curriculum starting at pre-K. And we need to start calling it that. Yes, I know in the old days play and fun was natural, but it isn't anymore. So let's teach the kids the difference between work educational things, and things that they do for emotion management for mental health, and create that as a curriculum. Because if we don't, the slide toward instant gratification, dysfunctional mental health is going to continue. And the biggest health issue with our youth right now is mental health dysfunction and the mechanisms they use to manage their own mental health. So the obesity, the drug addiction, the bullying, the behavioral stuff, the school gun shootings, all of those are forms of dysfunctional mental health. And yes, we can talk about guns, but ultimately the foundational long-term correction is to educate people about healthy mental health. Let's get back to that as an education system, as a public policy. And we have to be collectivized in doing this. I would also create, as a rule, a complete amateur sport, amateur creative art, amateur spiritual world that children are enforced to partake of. They can pick and choose. Not every child has to be an athlete. Not every child has to be a musician. But I believe every child should do something as part of their school curriculum. Because we need to create this as an accepted behavior, as an accepted part of our education. We spend so much time educating the children in subjects that they learn, but we never teach them how to relax, how to blow off steam in a healthy way. We let them figure that out themselves. And then we offer them a whole advertisement section of social media that they can scroll through, of substances they can use. When we're already providing dysfunctional emotion management for these kids, why not provide them functional, healthy forms of off-ramps for their mental health? And counterbalance that as part of the education so that they learn this as a behavior at a fundamentally early age. And at a societal level, we need to focus on that. I am the carb addiction doc. The addiction element is crucial at a societal level. You cannot get rid of carbohydrates without helping people to replace the role of carbohydrates and other substances with a better form of mental health. And we are lacking at that. So creating amateur sports clubs at school level, at university level, and creating an atmosphere of enjoyment, not just winning and losing. So yes, you may have your competitive league, you may have your Division I sports, but every Division I team should have a variety of sports teams underneath that, where the proceeds of that are generated by the Division I, absolutely fine, but revert those back, keep them in the sports arena, and have everybody at university, everybody at school participate. Whether it is sport, whether it is something creative, distribute that wealth in that direction. You're earning it, but you're not using it appropriately. And there's this disparity between Division I and everybody else. Then the next thing is create these in our society. Create sports and cultural clubs and promote these in our societies. We already talked about that in the context of restaurants and of food gathering places. But also juxtapose this to university. There's a lot of kids that should not be in college, that have no need or no right to be in an education system of higher learning, but they're there because they play Division I sport. Well, let's create parity with those sports institutions in our society. Let's create clubs that compete at a Division I level for people who may have a trade, for blue-collar workers, for people who are working, who still want to be part of this, young kids, for people that are in the military. Create a club that can compete at a Division I level, earn revenue, have multiple clubs underneath that. I grew up in a system like that. And if we promote this as not somebody special to watch in Division I and then nobody else partakes, let's create it as a formal societal level. Again, these are philosophical thoughts, but we can begin the journey toward that because God only knows we're sliding away from that. In my lifetime in this country, and I've been here since 1989, I've seen a progressive reduction in mental health and cultural diversity. It is the holiday season, and we call it holidays, but in reality, in my profession as a metabolic health specialist, this is the absolute worst time of the year. This year, we've just gone through Halloween, and there's probably Halloween candy still lying around. Whether you were celebrating or commiserating the election, there was crap to eat. We're coming up with Thanksgiving, then it's the whole Christmas block, then it's New Year, and then we go on diets. Here's a suggestion. Ketone IQ, a very rapidly absorbed source of ketones that suppresses appetite, that makes you feel good, is an incredibly powerful tool. Whether you use it with caffeine or without caffeine, my strong suggestion is just before you go out to Thanksgiving dinner, hit one of these babies. Or anytime you go out for a celebration dinner or whatever it is, a lunch, or you're going out to a barbecue, hit one of these guys. And what it does is it gives you that bump, it gives you that boost, it takes the pressure off you for, I must eat, I have to eat, and you're less vulnerable to being a victim of the carbohydrates and the garbage, the carbage that is always present at these meals. Protect yourself preemptively with Ketone IQ. Look down below and you'll see discount codes. We've talked about regulating food additives. So I'm going to put that one on there. Now, I'm going to come up with a really controversial one. And so follow me through this. We've just had here in Florida, I think it was Amendment 3 that didn't pass, but it was the marijuana amendment. And I'm actually pleased it didn't pass, although I'm a huge marijuana advocate. So here's the thing. I would absolutely ban and prevent the commercialization and the industrialization of marijuana products. However, I would completely remove any criminalization of personal use of marijuana and also personal growth of marijuana plants. I have no problem with somebody who desires to use marijuana, to have a plant at home, to grow it at home, and use it for personal use. But I have a massive, massive concern with the commercialization and the industrialization, and then subsequently the marketing of marijuana products to the public. Why don't we learn from the horrors of the big tobacco industry? Why don't we learn from the horrors of the big food industry, the manufactured food industry? Because the commercialized industrial marijuana industry is going to be exactly the same, and it is going to be destructive. Yes, legalize marijuana, decriminalize it. But stop the commercialization, stop the industrialization. Do not allow that to happen. Yes, the taxation is very attractive, but it is going to be the next big thing that destroys our society. A large part of these changes, the Make America Healthy Again commission is going to change, is big pharma, big tobacco. Well, why are we going to allow big marijuana? Let's stop it before it starts. We've deregulated opioids. Those are all industries of substance abuse problems grown at commercial scale and available to the public. If you look at the wine industry, it's mom and pop. Yes, there's some bigger producers of it. I have no problem with that. Because these are smaller companies. These are not massive, massive companies. And we need to allow that farmer to grow healthy wine. We need to allow the small producer of marijuana, but not the big commercial industry. And I know that that's going to take some thinking and some poke back, but I do believe that we have to do that. I would completely reform the nature and the governance of rehab facilities. Rehab facilities should be educational places, not punitive places. Yes, you get better. Yes, you get healthy. Yes, there's a medication component. But we should prioritize education and the desire to get healthier and develop healthier stress and coping management skills rather than just coming off a drug. It's a subtle thing. But rehab and self-care education is crucial. You know, a lot of people, and I don't want to go kumbaya on this, talk about going to India and for the meditation. I know the Beatles did a lot of this, but going somewhere where they do meditation, where they do Tai Chi, where they invest in puritizing yourself, and meditation those are the positive attributes. And if you're doing that, you're less likely to have problems with addiction. So why don't we promote the benefit of self-care, the benefit of self-purification, rather than going to rehab because you're a drug addict? Yes, there's that component. You want to clean up, but we've got to change the philosophical approach and destigmatize rehab. Because a lot of people don't go because of the stigma and because of the legalization of it and their fear of the law. Only America and New Zealand, and I think New Zealand's recently stopped this, so only America has advertisements for medication. In my opinion, we can immediately stop the advertisement of medications. We should have education of physicians and seminars for physicians to learn about new medication. And that should be built into the approval of medications for use in patients, new medications. There should be an educational seminar where doctors can get educational points for that. Not incentives to buy and push certain drugs on doctors, but let's educate them objectively about the risks and benefits and application of certain new medications. Physicians and practitioners should be educated, but you don't have to advertise to the public. Get rid of public advertisements. The whole pharma system has to be reformed massively. And there are several steps that I would take to reform pharma. Number one, prices should be negotiated. The price of drugs should be negotiated. Number two is I would have the discovery element of new medications regulated so that the pharma industry does not own the data. Because they will suppress bad data and they will artificially distort the reality of positive data. Look what they did in the statin industry. And that is probably the most horrific example of that. And now they're doing the same with the GLP-1 and the incretin industry. So we have to objectify and create an objective evidence-based repository that every human being can go to, but it should have third-party oversight. Do not allow the farmer that is incentivized to bring a new product to market be responsible for the data. They can be responsible for the trials, and clearly, there has to be complete FDA reform. The FDA is a mess right now. It is basically a vehicle that pharma uses to exclude competition and to promote their own products. They're in bed with each other. So you work for the FDA for 2 years, then you go work and create new rules and regulations, then you go work for the pharma company and apply. It is so corrupt. And I don't like to use that word, but we need to deregulate that. We need to have price reduction for pharma. It is bullshit that the reason we have to pay so much money for these drugs is because otherwise pharma is not going to do the research. They will always do the research. It's as crazy that you go to a car dealership to buy a new car and, oh, this is the last day of this deal. There's always going to be a new deal. There's always going to be research and development at the pharma level. But they leverage that to make us pay exorbitant money for drugs. We need to regulate at a national level. The cost of medication ought to be set nationally. Not by individual payers, not by individual contracts, and not by individual negotiations, and not by third-party kickbacks. The entire system is so corrupt and needs massive reform. I'm not even going to individualize it because there's so many different points that we can go through here. But the creation of new drugs should be a pharma responsibility. Should be a pharma responsibility with third-party oversight of the data and third-party ownership of the data. And pharma cannot decide which data they're going to publish and which they're not. So there should be transparency of the data collection, and it should be all-encompassing. They can't pick and choose what they put in and leave out. So that we have evidence-based objective data collection. But the FDA needs to reduce the criteria they use to bring new devices and new drugs to the table, to the market. And there's a lot of regulation that still can keep things safe without being exorbitant and delayed in time. So there's a massive reform that needs to take place, and that can be a category and a discussion all by itself. Please leave comments about how you want to change that. There needs to be a radical reform in the entire healthcare industry as it pertains to insurance. We need a single EMR system that is transparent and universal, and the ownership of the medical record should be the patient themselves. But we need a single EMR that is universal and that talks to itself, so that my records can be seen by other folks, and the gatekeeper is the patient. Not me, the doctor, not anybody else. So that should be available at a national level. And it can be privatized, but it should be built at a national level, instead of having all this fractionated healthcare stuff that is costing the individual a huge amount of money. The healthcare industry, the health insurance industry, should also be regulated so that you cannot have a health insurance company owning a pharmaceutical company. That is just such a ridiculous notion. And yet Aetna and CVS are owned by each other. How ludicrous is that? There needs to be a universal healthcare system for children. Ooh, think that one through. So from inception to 18 years of age, or maybe 20, 24 years of age, we can set the upper limit, but at least through 18, there should be a universal healthcare system. And I'm a huge proponent of a two-tier system. That is not communism or anything like that. We need to have a better national safety net. But there should be universally applied rules for certain procedures and certain medications, not arbitrarily assigned by insurance companies themselves. We need to get rid of the concept of prior authorization and allow physicians to manage their patients. And yes, physicians can be monitored in terms of how they manage their patients, but to have all these prior authorizations and have the insurance companies manage the patients, not the doctors, is a huge liability for patient care. And we can create national criteria for the approval of certain surgeries and certain medications and certain health parameters. And if the insurance companies don't like it, get out of the business. But we can massively reduce costs if we do that appropriately. So a huge reform on insurance, the insurance industry, and also the bullshit about how insurance companies contract with physicians and contract with hospitals. It is ridiculous the way that is done, and there's no transparency, and it should be done at a national level, and physicians should be reinforced at a national level. And as individuals, what's happened to healthcare is it's become company-oriented, where physicians have become employees of the company, and physicians base their care of their patients on codes and on insurance coverage, not on what the best healthy pattern is for the patients. One of the reasons I'm a mom and pop and I do a lot of self-pay is so that I can take care of my patients directly, free from the burden of best practices and guidelines and insurance expectations, which directly conflict with the best health of patients. We need to restore healthcare to the patient level, not to the business level. And while it's fine to have small practices be in a cooperative, that absolutely needs to happen. Furthermore, and this is a big one, we need to get rid of contingency billing in med-mal. The majority of physicians always consider malpractice and risk to themselves before they consider the health of the patient. And that creates great liability in patient care. And the patients that most need the healthcare system are the most at risk patients, and physicians stop taking care of those patients because they cannot put themselves at risk. Contingency billing has to be removed from healthcare, in my opinion. And what we do is we create a tribunal, a legal scholar or legal person, a lay person, and a medical person to judge each malpractice case. And then it goes forward. If there's merit to the case, it then goes forward to trial or to being sorted out. And there should always be, right now the way the system works is the patient wins, they get a monetary settlement. And there's usually, let's be quiet about it, let's not talk about it, so nobody knows. There should be not a punitive, but an educational component for the physician or the facility that perform malpractice if they're found guilty. There can be a payout to the patient, but it should be a reasonable payout. It should not become an industry like it is right now, where med-mal is an industry. But there should be a reckoning for the physician, for the facility, an educational thing, not a punitive thing, as well as compensation for the patient. But we can radically reduce and come to terms with the rest of the world in terms of med-mal. Right now, med-mal is a profit-making industry, and that is hugely problematic in terms of how healthcare is conducted. But we need to radically reform hospitals and re-incentivize mom and pop practices that can be a collective instead of physicians being sheep to large conglomerate financial institutions that are making profit on their business. And especially we need to separate out physician groups being owned by large hospital systems. That is ludicrous. That is anti-competitive. And there's so much reform that can be taken on in that space, where the people that are making the most profit and sucking the funding out of healthcare are the administrators and the for-profit market, and the healthcare dollars are not being distributed to the doctors. Where talking to a patient and giving a patient fundamental root cause advice doesn't get compensated, but doing tests and doing procedures is where the compensation is, and nothing changes. That entire mentality has to change. At a healthcare level, we need to go away from epidemiologic therapy back toward physiologic therapy. Treat the cause of the disease, don't treat the outcome. Or maybe both need to be treated. But if you don't treat cause, the disease is inevitably going to get worse. So we have to change our entire philosophy of healthcare from the practitioner's mindset all the way through to the big industry. And we can break up and fractionate and reduce cost to these huge big health systems. The big health systems, the mega hospitals, are fine. But I would like to see healthcare, small hospitals, small surgery centers, small facilities return to the communities. And a hub and spoke type model is far better than shutting rural clinics because they cost too much. They don't make profit, in other words, but they're still working well to serve the patients, and centralize this so that a poor farmer has to decide whether they're going to work 300-400 miles from a hospital or move to the city and take a menial job and leave their farm. The hub and spoke model has to be incentivized and reinforced and populated. And I would place very strict penalties on food misinformation and mislabeling by the food industry. Next, I would completely reform university education system. Completely reform the university education system. It has again become a profit industry. And certainly medical training, which is my background, I would radically reform medical training. I would go to the same system they use internationally, where young doctors, this is going to be a radical discussion, and it's a conglomerate of a variety of different models from across the world. If you come out of high school, you graduate from high school, and you are interested in a career in medicine, I would have a first year, free first year of medicine. So anybody can go in, anybody can start, and the first year is free. And everybody goes into that healthcare system, no matter which way you go from there. But it's free. It's the Dutch system. So you come out of high school, you go to medical school, and you start your first year. Then, during that first year, you decide what you want to do. Do I want to go in nursing? Do I want to go into pharmacy? Do I want to become a physician? What line do I want to go in? And you then establish a minimum of a 4 or a 6 year curriculum, but you have an entrance exam at the end of the first year. So that you don't have to have this ridiculous criteria of academic knowledge, because academicians don't necessarily make the best doctors. You allow everybody to go in. Then once they're in the healthcare system free for the first year, you then have an examination, and a certain percentage, a fraction, the top fraction of that examination, then can go forward into medical school. That's the way I would play it. So that you select your tier of people that are going to go into healthcare based on a universal knowledge base of some rudimentary healthcare, rather than just having very smart academic people who may not necessarily make the best practitioners go into healthcare. And whether you want to go into healthcare administration, whether you want to go into pharmacy, whether you want to go into nursing, rehab, doesn't matter what you want to do. The entrance point is the same, and then we triage you out from there. And I would lengthen the curriculum then. If you want to be a healthcare practitioner, right now it's a 2-year course after some rudimentary training to be a PA, to be a nurse practitioner. I'm not denigrating that. But why not let everybody go forward through a 4-year curriculum where you are learning physiology, where you're learning the cause of disease instead of just following an algorithm and a recipe, which is what healthcare has become, a universal algorithm that everybody gets applied to. Allow these smart people that go in, whether they're PAs, nurse practitioners, or physicians, to learn to understand and ask the question of root cause and manage root cause along with outcome.